Hello and welcome to the Natural Healing Channel, where we share natural remedies for a health and wellness. In today's video, I'm going to share top 6 foods to avoid if you have arthritis. Arthritis is a condition that affects your joints, causing pain, stiffness, swelling, and reduced mobility. There are many types of arthritis, but most of them involve inflammation, which is your body's natural response to injury or infection. However, sometimes inflammation can become chronic and damage your joints and other tissues. This can lead to more pain and disability. One of the factors that can influence inflammation in your body is your diet. Some foods can trigger or worsen inflammation, while others can help reduce it. In this video, we will look at 6 foods that you should avoid if you have arthritis, as they may increase your pain and inflammation levels. We will also give you some tips on what to eat instead to help ease your symptoms and improve your overall health. Before we start, please make sure to subscribe to our channel and hit the bell icon to get notified when we post new videos. Now let's get started with the list of foods to avoid for arthritis. Number 6. Salt. Salt is another food that can cause inflammation in your body. Salt can increase the fluid retention in your tissues, which can cause swelling and pressure in your joints. Salt can also raise your blood pressure and affect the balance of minerals in your body. High salt intake has been linked to increased risk of autoimmune diseases such as rheumatoid arthritis, RA, where your immune system attacks your own joints. If you have arthritis, you should limit or avoid foods that are high in salt or sodium, such as processed meats, canned foods, pickles, cheese, chips, and fast foods. You should also check the labels of packaged foods for sodium content and choose low sodium or no salt added options. You should aim for no more than 2,300 milligrams, mg, of sodium per day, which is about 1 teaspoon of salt. Instead of salt, you can use herbs and spices to flavor your food, such as garlic, ginger, turmeric, rosemary, basil, oregano, and thyme. These herbs and spices have anti-inflammatory properties and may help reduce pain and inflammation in your joints. Number 5. Sugar. Sugar is one of the most inflammatory foods you can eat. It can raise your blood sugar levels, which can trigger the release of pro-inflammatory cytokines in your body. These are chemical messengers that can cause inflammation and pain in your joints. Sugar can also increase oxidative stress, which is a condition where there are too many free radicals in your body that can damage your cells and tissues. Sugar can also contribute to weight gain, which can put more pressure on your joints and increase inflammation. If you have arthritis, you should limit or avoid foods and drinks that contain added sugars, such as sodas, candies, pastries, cakes, cookies, ice cream, and fruit juices. You should also check the labels of packaged foods and sauces for hidden sugars, such as high fructose corn syrup, sucrose, glucose, fructose, maltose, dextrose, honey, agave nectar, and molasses. Instead of sugar, you can use natural sweeteners that have anti-inflammatory properties, such as stevia or monk fruit extract. You can also eat fresh fruits that are rich in antioxidants and fiber, such as berries, cherries, apples, oranges, and grapes. However, you should still limit your intake of fruits to avoid excess sugar consumption. Number 4. Saturated fats. Saturated fats are fats that are solid at room temperature and mostly come from animal sources. They can increase inflammation in your body by activating a protein complex called nuclear factor kappa B, NFKB, which regulates the expression of genes involved in inflammation. Saturated fats can also increase your cholesterol levels and raise your risk of heart disease and stroke. If you have arthritis, you should limit or avoid foods that are high in saturated fats, such as red meat, especially processed meat, butter, cheese, cream, lard, and coconut oil. Instead of saturated fats, you should choose healthy fats that have anti-inflammatory effects, such as omega-3 fatty acids and monounsaturated fats. Omega-3 fatty acids are found in fatty fish such as salmon, mackerel, sardines, and trout. They can help reduce inflammation and pain in your joints by blocking the production of pro-inflammatory cytokines and enzymes. Monounsaturated fats are found in olive oil, avocado, nuts, and seeds. They can help lower cholesterol levels and prevent oxidative stress and inflammation in your body. Number 3. Trans fats. Trans fats are artificial fats that are created by adding hydrogen to vegetable oils to make them more solid and stable. They are often used in processed foods to extend their shelf life and improve their texture and flavor. However, trans fats are very harmful for your health, as they can increase inflammation, cholesterol levels, blood pressure, and insulin resistance. They can also damage the lining of your blood vessels and increase your risk of heart disease, diabetes, and stroke. If you have arthritis, you should avoid or limit foods that contain trans fats, such as margarine, shortening, baked goods, fried foods, snack foods, and fast foods. You should also check the labels of packaged foods for partially hydrogenated oils, which are another name for trans fats. Instead of trans fats, you should use healthy oils that are liquid at room temperature, such as olive oil, canola oil, sunflower oil, or safflower oil. You can also use nut butters or hummus as spreads instead of margarine or butter. Number 2. Refined carbohydrates. Refined carbohydrates are another type of food that can cause inflammation in your body. These are carbs that have been processed to remove their fiber and nutrients, such as white bread, white rice, white pasta, white flour products, crackers, cereals, and chips. Refined carbs can spike your blood sugar levels and increase the production of advanced glycation end products, AGEs, in your body. AGEs are harmful compounds that can cause oxidative stress and inflammation in your joints and other tissues. If you have arthritis, you should avoid or limit refined carbs in your diet and opt for whole grains instead. Whole grains are carbs that have not been processed and still contain their fiber and nutrients. They can help lower your blood sugar levels and provide you with antioxidants and anti-inflammatory phytochemicals that may protect your joints from damage. Some examples of whole grains are oats, quinoa, brown rice, buckwheat, barley, millet, rye, spelt, and bulgur. Number 1. Nightshade vegetables. Nightshade vegetables are a group of plants that belong to the Solanaceae family. They include tomatoes, potatoes, except sweet potatoes, eggplants, peppers, except black pepper, and spices such as paprika and cayenne pepper. Nightshade vegetables contain a chemical called solanine, which some people believe can trigger or worsen inflammation in people with arthritis. However, there is not enough scientific evidence to support this claim. Nightshade vegetables are actually rich in antioxidants, vitamins, minerals, and fiber that may benefit your health and reduce inflammation. They may also have anti-inflammatory effects by inhibiting NF-κB and reducing oxidative stress. However, some people may be sensitive or allergic to solanine or other compounds in nightshade vegetables and experience symptoms such as joint pain, stomach upset, headache, or rash after eating them. If you suspect that you have a sensitivity or allergy to nightshade vegetables, you may want to try eliminating them from your diet for a few weeks and see if your symptoms improve. You can then reintroduce them one by one and monitor your reaction. If you find that nightshade vegetables do not affect your arthritis symptoms, you can continue to enjoy them as part of a balanced diet. So these are the top 6 inflammatory foods to avoid for arthritis. By eliminating or limiting these foods from your diet, you may be able to reduce inflammation and pain in your joints and improve your quality of life. However, remember that diet is only one aspect of managing arthritis. You should also consult your doctor about the best treatment options for your condition, such as medications, physical therapy, exercise, and supplements. You should also follow a healthy lifestyle that includes getting enough sleep, managing stress, and staying active. We hope you found this video helpful and informative. Please leave us a comment below and let us know what you think. Also, don't forget to like this video and share it with your friends. And if you want to see more videos like this one, Please subscribe to our channel and hit the bell icon to get notified when we post new videos. Thank you for watching and have a great day.